You're tuned in to Z 101.9 FM, your lifestyle, leisure, and business radio.
In the heart of Accra, nestled in the vibrant neighborhood of East Legon and New Beacon, a 360 multimedia firm has emerged. Introducing Z Multimedia. With a steadfast focus on lifestyle, leisure, and business, we set out to bring high-value oriented programs that captivate the taste and desires of our audience. From the captivating airwaves of Z 101.9 FM to the dynamic visuals of Z TV and the innovative realms of Z Digital and the incubation of advanced technological knowledge at Z-Tech, every facet of modern media is meticulously curated to engage and inspire. Also, let's not forget the New Finder newspaper, now under the Z Multimedia umbrella, delivering insightful journalism with a business focus. Join us on the journey where innovation meets inspiration, where lifestyle meets leisure, and where business thrives. Change is here. Z Multimedia, your lifestyle, leisure, and business platform.
Hello, good afternoon, and welcome to the Z Wellness Link. I'm your host, Dr. Paddy Aite, and today we are talking about dental problems. Our topic is preventing common dental problems with emphasis on cavities, gum disease, and bad breath. Oral health goes beyond a beautiful smile. It's essential to overall health and well-being. Our dentists, well, we go there because we've got pain, and usually we avoid the dentist as long as we are not in pain. Because there are some needles, it's very long and it's very painful. And I find that needle intimidating personally, so I always insist that they should put a cream on my gum before they give me the needle, of which my dentist laughs at me copiously, because I don't like injections, yet I give people injections. Today, hopefully, we've got our two lovely ladies in studio are going to eliminate that fear. That is in my heart.
Uh-huh.
We have Dr. Ama Amenin Dakon, who is a dental surgeon, and Dr. Esther Alute. Ladies, you're welcome.
Thank you.
Yeah. How's dentistry? Is it nice?
Very nice.
You're enjoying
Very
yourselves?
Interesting.
I
yeah.
love my job.
Oh.
Yes.
So
Same. I
it's
love my
everything.
job.
It's what I want to do. So I mean,
And you're enjoying it?
Very
Yes,
much.
I like the hours.
aside
well,
the hours.
I like the working hours. They don't call you at 2 a.m. That Charlie.
Well,
Well,
Even when Kaka is
depends.
worrying you find a way to manage it.
yes,
well.
that's true. But then I mean, for me, I like the interaction with the people,
Mm-hmm.
having to explain what's going on with them, giving them
Yeah.
the options, the whole thing. It's exciting.
Yeah.
for
It's
me.
exciting.
Yeah.
Yeah. But the needle, no. The
So you see,
needle, no.
I wanted to correct you from starters because a needle, the diameter of a needle is not the same as the
As
ones you
yours.
use.
Eh,
So
yours-
it's actually
Yeah.
very
Your needle is
big.
what size?
So actually, the it looks longer.
No, it's what size?
I don't want to go into
Say
it.
the
But then
size. I'll mention my own.
the truth is that it looks longer because of the access. So if you have to
Yeah.
reach a part, that's why
It
it
has to
looks
be
a bit
long.
longer.
Deeper.
But
yeah.
in actual, the diameter is actually thinner than what you use for subcutaneous injections.
So it is the length that frightens us.
Probably, and maybe the whole technique. So
Yeah.
once the person dealing with you, for me,
So
when
let-
I haven't.
So
when
let's start with that.
okay.
There are ways you can give the injection for it to be less
Painful
frightening
and frightening.
and less
yeah.
painful.
Yeah.
Yes,
Exactly.
Yeah.
Precisely.
it can be done
It can be
Oh,
done. Very much so.
definitely.
even without the gel.
Well, that's also another factor. So if you want to give a painless injection,
Mhm.
it's an injection. So painless injection in itself is a misnomer.
Mm-hmm.
So for starters, you have to expect something.
Mm-hmm.
Mm.
Yeah.
But if your clinician is able to dry the area well, stretch it in a certain way, apply your topical anesthesia, allow it to work enough.
Yeah, that's another thing.
and then-
Allowing
yeah.
it to work.
Wait,
The
wait, yeah.
angle at which you're going to insert the needle,
Mm.
it tends to be less painful. Even the distractions, so maybe when the person is talking to
To
you
you.
and other things,
Exactly.
your nurse is rubbing your shoulder.
Rubbing shoulder all day inside.
And-
Yeah.
Yes,
Yeah.
because you see, that's the problem.
Okay.
People
Hmm.
tend to be anxious. It's dental anxiety. Anxiety is expectation of something that doesn't exist yet. So you are fearful for something that you haven't yet encountered.
Mhm.
Yeah.
So it's all about trying to alleviate it. Perhaps the way you're even received right from the reception, coming in, the way the dentist will smile at you, talk to you as if you're old friends. It all comes in to alleviate all that anxiety. Explaining what you're expecting, it all helps. So it's multifactorial, but
But it's not as bad as we think.
No, it's not as bad
and a
as you
dentist
think.
does not cause pain. The dentist takes
Takes
away
away
the pain.
Thank
So-
you.
While you-
David, if you've got a hole and it's not painful, and you go and the dentist says he's coming to do something, then it's like he's causing pain.
No.
No.
So the reason why you
Or he's taking away future pain.
No, the reason why you came, for most people in Ghana, we stay home till the pain,
It's-
like, me to me and doing that, I say,
No,
you
no.
go me through.
No, what they say is
You know
that
the guy-
mentally and that. So
That
because
one-
he can't sleep.
That's the
You
only
can't talk
reason
to-
why
So
he'll
then
come.
they'll be
Yeah.
there at 6 a.m. sharp. They are there waiting in the queue. But then the problem is, in that case, this one is a clear example. We are definitely alleviating the pain.
Yeah.
And if you come with a cavity that is not painful yet, the way we fill it is not going to cause you pain.
At
So the
all.
dentist does not cause pain. The dentist takes away the
Only
pain.
takes away pain.
So
Mr.
let's
Kante.
establish
They
that for
taught them that in
starters.
school, but we still don't believe it.
No.
Oh, no, this is in
It's
practice.
actually the truth.
It's
no,
in
no one
practice,
taught us
the
this. But in actual sense, the
Yeah, but
dentist does not cause
in fact, the truth is that our fear of pain from the dentist is mostly
Head.
is in our head.
Yeah.
Yes.
But in reality, there are options that can actually make you feel
Exactly.
less anxious. You know, when you're anxious, you feel more pain. You perceive more pain than actually exists.
actually, yeah.
Precisely.
And I have found that the numbing gel helps relieve my anxiety. Once they put the gel there, I'm like, oh, so something that's working.
Yeah.
Even when they put the injection inside and it goes deep and I can feel it there, I'm like, oh, the gel is
The
working.
gel is-
Yeah. That's okay.
So it works for me. All right. So, shall we proceed to discuss? Now that I've alleviated our fears, let's look at our this. So, what are the major dental problems that people come to your facility with?
Okay, I think that the commonest are cavities, pain, toothaches, and then gum issues.
Okay, so cavities, toothache, and gum issues.
Yeah.
Okay. What causes cavities?
So cavities are caused by a combination of things. What you eat, how you clean, and then also like bacteria that's already present in your mouth. So then if what you eat stays in your mouth for a long time, then bacteria also has time to work on it. And then the byproduct of what the bacteria produces after eating the food or feeding on the food in your mouth then breaks down the tooth. So you hear people saying that bacteria causes the cavity. It's true, because when they eat the food, the byproduct breaks acidic, and then it breaks down the tooth and then causes cavities. So the longer you don't clean well after eating, then you have enough time for the bacteria to work on the food, and then you have cavities.
What you have said brings a question to mind.
Okay.
Does that mean that the ideal situation is brush your teeth every time you eat something?
Okay.
That's not practical.
So
No, but I'm asking.
So let me take this one. So the truth is that for the entire caries formation, she's simplifying it, but then the truth is it's a whole process. You have the bacteria that's working, then you have the tooth that is there in a certain part of the tooth that is exposed. We also have the plaque. So plaque is basically food debris, bacteria byproducts in the matrix, but it's predominantly bacteria. Okay, so the bacteria is living in the plaque. Okay, so that if you, for a normal person, when you wake up on a day you didn't brush your teeth, you might notice there's a whitish thing around your teeth. That when you brush goes away, that is plaque. When that plaque stays for long, within 24 to 48 hours, your saliva contains some ions that will now mineralize the plaque. Then that one will become hard. When it becomes hard, it becomes calculus. Now this is basically bacteria in that matrix. So the bacteria will now start working on the food. The food basically, usually the sugars. So it breaks it down to get the sucrose. And then in the presence of the sugar, you now have, or in the presence of the sugar, then you now, the bacteria will now break down the sugar and then produce the acid as a byproduct, like she said. Now, the acidic environment will allow ions within the enamel of your tooth to seep out. That is demineralization. Right. So when the ions move out of the tooth, the tooth is compromised. The enamel of the tooth is compromised. That's the outer shiny is compromised because the ions that are making it hard in a certain respect have come out of the tooth. So your body, in an attempt to buffer this action, contains other ions, bicarbonates, that will buffer. So acid plus base will be neutralized. So once that neutralization goes on, then the place is less acidic. Then the ions go back into the tooth. That is remineralization. So on a normal day, when you eat, all these processes are going on. So the problem comes with the time. That's why time is also another aspect to think about in caries formation. So whether you are given sufficient time for remineralization to happen after demineralization. Okay. So if you are the type who always has chewing gum in your mouth and then it's sugary and all of these things, you know that you've had your food in the morning, but you've had sweet chewing gum in your mouth for the whole afternoon. That means it's just demineralization going on without a time for the body to remineralize when you have to. Then it's afternoon, you take it out, you eat again. So if you don't allow the body to buffer for the normal work that is going to occur on your tooth, then that's when we start getting compromised and caries are more likely to form.
I haven't answered my question.
Yes, no, so
I've understood the explanation.
Yes, so based on this explanation, you cannot brush your teeth after every meal. Because you, if you brush your teeth after every meal, you actually be losing the ions.
That's the point I wanted to make. Yes. So how often should we then brush our teeth?
Twice a day.
Twice a day?
For 2 to 3 minutes.
Not more than twice a day? We can't do an afternoon quickie.
It depends. So people who have orthodontic treatment are wearing braces and other things. It's recommended that you may, or Invisalign, you may need to brush with every meal, but ideally not too much. Just concentrate on doing your 2 to 3 minutes of effective brushing, getting all the surfaces with the right instruments. I think we are good to go.
Okay.
And flossing.
Okay, that's a difference. So that we've just spoken about only cavities.
Yeah.
We've spoken only about cavities. Hey, Rade. The things talk about, there are plenty. So we've understood how cavities occur. To conclude on cavities before I talk about gum disease,
Right.
there's how you eat certain things make a difference.
How?
How? Like say toffees, sweets.
Okay.
Yes. So if you're the type who has toffee in your mouth all the time, then that's why.
No,
I
but how
explained
you
all
eat the
that.
toffee?
How would you eat it?
It's like between chewing and
Between
sucking on the
chewing
toffee.
and sucking.
Very good. So if you are going to be chewing on it, if it's a chewy food, it's likely to get stuck on the surface of your tooth. The teeth at the back, they're like a table, but it's not flat like a table. It has cusp and it has fissures. So if you are chewing a soft meal, that can get stuck in the fissures. Then you have created a nice environment in a wet place for bacteria to work on, because it gets stuck in the fissures, and then the bacteria will work there. It has substrate, it has everything to create a cavity. So it does matter compared to maybe sucking it on your tongue, where it just.
So sucking a toffee is better than chewing a toffee.
We can say that. We can say
Well,
that.
somebody in my life has no cavities, 0.
Yeah.
And she says it's because she was taught to
Chew.
chew with her front teeth only for toffees. So if she's going to bite a toffee front, she doesn't bite with the back. Those of us who bite with the back, we have the rules.
It's true. I think she has a point.
She has a
She
point.
actually has a point.
She has a
No,
point.
and what she said, I was like, that makes so much sense.
She
Okay.
has a point.
And she
has
said,
a
yeah,
point.
so toffees she won't chew with her back teeth.
Yeah.
No, and you see, but the sweetness of the chewing of the toffee is the back teeth. You have to admit it.
Fantastic.
You put it there and grill.
So if you can clean properly after chewing the toffee, then that's on you.
So if you chew the toffee, you must brush your teeth immediately. That's your punishment for chewing. Because otherwise, that thing will be there for a long time and create
Okay,
holes.
Yeah. We'll have time for.
Because the twice a day, for the chewing toffee people,
Ah,
the toffee, if it stays there for long, it will cause trouble.
it will cause problems.
Ladies and gentlemen, we shall take our first break. We'll be playing a song. The title is The Glory by Obapa Christie.
You're tuned in to Z105.
Welcome back. That was a quick break. This is the Z Wellness Link on Z101.9 FM. My name is Dr. Padiaite, and with me in the studio are two beautiful, lovely ladies who have has rekindled my love for going to the dentist. It's Ama Ameni Ndakon and Esther Ality, both dental surgeons, and one of my very good friends is a dentist. He wasn't able to allay my fear, but it looks like you're doing a better job than him. I shall let him know that, Massa.
Good to know.
You know, try a cry.
Wow.
Gum disease, Esther.
Yeah.
Gum disease. What is gum disease, and how does it come about, and why is it important?
Okay. So gum disease is an infection of the gums. Usually because of bacteria again. But sometimes it's also because of an inflammation which occurs when irritants come into contact with the gums. Usually, or the most common cause of gum disease, again, is plaque, as Dr. Ama explained. So food, residue staying on the teeth for a while, containing bacteria, then irritate the gums and then cause what usually is called gingivitis. Okay.
So how do you know you have gum disease?
So the earlier signs of gum disease in most people is bleeding.
So if your gums are bleeding when you brush your teeth?
When they brush, or sometimes even without provocation, that's a more deeper or a more severe symptom. But
so if you are brushing your teeth and you see blood,
it's not because
you have gum disease.
Okay, it's not usually because sometimes your brush is too hard and it's hitting your gums.
You have gum disease until your dentist says otherwise.
Yes. So it's better to assume that you have gum disease and get yourself checked out. Then we also have swelling of the gums. we also then getting more severe. You have the gums receding. Then you have different parts of your teeth getting exposed. Then some people experience sensitivity because the gums are receding. Then when gum disease progresses further, with what I just spoke about, the gums receding, you have something called periodontitis. It's also gum disease, but it's a more advanced version. Okay, so now we are getting into bone receding, the supporting tissues of the teeth receding,
and the teeth falling out.
And then you have people say, "Oh, my teeth were not like this, but now some gap is opening somewhere. My tooth is lying down in a position it wasn't before."
As an adult,
teeth are moving. As an adult, teeth are moving, and then teeth fall out. That's like the almost end stage of your gum disease. Your tooth falls out of your mouth. So that's like the progression of gum disease. But usually it's caused by plaque.
Is it painful?
It's usually painless.
Yes,
And-
usually painless.
And I'd like to bring up the, how in Ghana we like to say that, we need to
Tutu.
it's not supposed to be.
Yeah.
If you take good care of your gums, your teeth won't come out.
That's right.
So it's possible to
People
live.
say that you look after me for my teeth to grow, so me to...
So for my teeth to fall out.
No, you
and
look
to
after me
grow.
for my teeth to grow, so me to look after you for your
For
teeth to
yours
fall
to
out.
fall out.
It's not supposed to fall out.
At
It's not,
all.
if you have,
Hey!
if
not
you're able
Because I can't
to,
tell what that is.
because back then they were not having dentists, so they were living with the plaque till
Yeah.
80. So imagine an 80-year-old who has plaque from the first day he started eating,
Yeah.
and it keeps accumulating. So I think about that.
Now
Remember,
you need a concrete drill.
To
telling
break it
you.
up.
so when we do when you brush your teeth or other things, you're able to get rid of the soft plaque. But when it's mineralized, when it's hard, that one, no matter what you do, it's not going to come. It's very firmly adherent on the tooth. It doesn't come off until we use our instruments to take it off. So imagine an 80-year-old who has never had cleaning. He has plaque. The plaque is older than
Yeah.
his
Older than the
children.
dentist.
Precisely, the plaque is
Yeah.
older than us.
Exactly.
So in that case, the teeth they have no say. They will fall out
Yeah.
of exasperation. but then that is it.
Yeah.
Hey, this gum disease is serious.
Very serious.
And even another thing that's common in our local people is in pregnancy. So people say that, it's normal in our family when you're pregnant you lose your teeth because you're throwing up in your mouth. It's actually gum disease. It has a physiology with pregnancy where pregnancy and the hormones that come with it and all the changes in your body sort of affects the stability of your gums.
Okay.
It's true, but it doesn't mean that your teeth
They
are
shouldn't
allowed to fall out.
Mm.
So once you have someone with teeth falling out in pregnancy, it's also gum disease. But amongst our local people, it's like, when you're pregnant, it's okay, your teeth fall out. In my family, even my big sister, three of her teeth fell out when she gave birth to the firstborn, and it's all gum disease.
If you lose 3 children, 3 teeth per child,
Yes.
and you have 6, that's
Then
18 gone.
Yes.
Exactly.
The 2 has dropped.
and it actually can be prevented, even though
Yeah.
it's a systemic thing with hormones and everything.
Yes.
It can be prevented. So in other jurisdictions, when you get pregnant, they actually refer you to your dentist, but not everywhere.
If you
Yes.
haven't told us that,
Yes.
if you tell us, we'll refer them to you.
Yes. They
Yes.
actually have
And once
to
you
be-
get pregnant, no, go
you
and see your
should check.
dentist.
It's good
Yes.
because it also has there are adverse pregnancy outcomes that can actually be prevented. They have an association with poor oral health. So if someone has poor oral health, there are studies that show that they have a tendency to have either gestational diabetes,
Okay.
Yeah.
preterm birth, low birth weight,
Yeah.
and other more local things as occurring in the mouth.
Gestational diabetes, that one is not the poor oral health. It's the food that they were eating that caused the
Yes, but then it
Problem
has
one.
an association.
However-
There's an
Association.
association.
However, preterm birth could be actually inflammatory related, and this is
Exactly.
inflammatory.
Yes.
Exactly.
So yes, there is something
Yes.
over there.
There are
Hmm.
papers. There are lots of papers on
Oh,
it.
you haven't tried crowd. You've kept this.
And that's
Okay.
why I hear.
We shall have you come and do a presentation to the Society of Gynecologists and Obstetricians one of these days
Why
as to
not?
why we should be sending people for
Yeah,
For-
in pregnancy.
in pregnancy for
Yeah.
dental assessments,
That's right.
because for all you know, that's the only the
Might
only
be
time
that
we'll get
way.
them to go.
Indeed.
We'll mandate that visit and say, hey,
Why not?
you need to see your
Yeah.
dentist. It makes quite a bit of sense
That's
actually.
right.
It makes quite a bit of sense. Okay, so that's gum disease.
That's right.
And then what causes bad breath?
So bad breath assistance. When a client comes to me and says I have bad breath, there are three. It's family.
You don't tell them who told you so.
It gets to that phase. At a point, we need to ask.
How
So,
do you know?
there are different types of the technical term is halitosis. There are different types of halitosis. We have true halitosis where the person truly has bad breath, and then there's pseudo halitosis where the person may have had bad breath in the past and may have had it treated, but still feels it's still there because there's a psychological aspect to a lot of things. And then there's halitophobia, where the person is scared of getting it and is going to extreme lengths to prevent it, and sometimes it goes slightly overboard. So once you establish that it's a true halitosis, then the causes there are so many causes. There are local causes where it's actually coming from the mouth. When it's coming from the mouth, it may originate from plaque that we've been talking about from the very onset, plaque. Or it could be from, even if there's a cavity, there could be it also gives off a bit of bad breath. Sometimes if there's an abscess from any of these infections, it can also, these are local causes of bad breath. And then right next to the mouth, we move into the ENT region. So the throat, sometimes if there's tonsillitis, tonsil stones, they can give bad breath. Then a little higher than the mouth, we have the sinuses. Sinuses are holes in the skull to help keep it a little light, exactly. So when the sinuses get inflamed, it also comes off as bad breath. And then other conditions in the throat can also come off as bad breath. And then the whole system also, sometimes if someone has liver conditions, someone has kidney conditions, it can come off as bad breath. Even diabetes, so if the person's in diabetic, ketosis, they'll give off the fruity smell. So there are so many causes of bad breath.
And if you're on a keto diet?
Then
on the keto diet,
you're expecting the ketones.
You're expecting ketones, so you may have
give off the fruity smell as well. Exactly.
Okay, so all these are possible causes of bad breath.
That's right.
Your dentist will do your assessment and find out why,
Which one is?
and then
we move
prescribe
into treatment.
the right treatments for it.
That's right.
Please tell us about tonsil stones. Yes, it's an ENT problem, but you see it. When you look in the mouth, don't you see it?
Yes,
Yeah.
occasionally we see it. So we have.
Do you remove them?
No, it's
You
not.
don't
It's
remove
not.
them?
It's not in my. I'm not supposed to work beyond the mouth. So
Yeah.
Okay.
I'm not supposed to be a hero. I'd refer you when I see any. But the tonsil stones, they are these whitish things, like a little pebble, very tiny. Occasionally, you might feel it pop into your mouth, and they smell foul.
When it comes to your mouth, you know it.
Terrible.
It has
there.
appeared.
They smell foul. So sometimes when you have it occurring over and over, you need to see your ENT specialist for that. But occasionally they recommend that you use the water flossers. We have a type of floss which is it jets out from it's called a water flosser. Sometimes they say you can use that to get rid of the tonsil stones when you can see
When you flash it,
it
then it will go down.
It will pop out. Then you might
It will go
swallow
down. Then swallow it.
Hey.
Then your stomach will smell.
Well, I also know about warm water goggles, which helps.
Warm water,
release
Does
the
it dislodge it?
stones. It just helps the stones to come out.
But these are ENT, so we
Yeah.
work in the mouth, and then it's some parts of the face as well,
Yeah.
but not in the throat.
But I don't know what proportion of patients have tonsil stones, but because of the way they smell, I would have an impression that if somebody has bad breath, that's the first place I'll look. That's the first place I'll look and say, is there anything they know? Okay, now let's.
Actually, might be a cavity somewhere with patch food in
There
it.
Inside.
could be a
Yeah.
cavity, or there could be an abscess. I had a client who came in, we did everything. He had good oral hygiene, but there was this persistent smell. So we did an examination, then we noticed there was one wobbly tooth somewhere. It looked
Yeah.
nice when you look in the mouth, and it's been there for a while. He didn't really bother about
Yeah.
it. It was abscess, a nice abscess underneath the tooth, reeking of an offensive odor.
Ah,
Yeah.
So once we took out that one, got rid
you
of
took out
it.
the tooth.
Yeah, you had to go
Yeah.
at that point.
Oh, you couldn't save the tooth.
No. So if
So-
you have a wobbly tooth and you come early, we may, and depending on what.
They said there's an abscess on that, so you take it off and then remove the abscess and
And
put
put it back.
inside.
Oh no.
It's not standard practice.
You're not God. You don't do
More
that
of an
yet.
artificial replacement that we can do.
Yeah, but it's a bit. I'm just looking at it and it's like, oh, so he lost his tooth.
Oh.
Anyway, but once you're able to deal with the abscess, it's
The smell went because he had cleanings elsewhere and everything, but that one wasn't picked up immediately. Perhaps he hadn't developed to that point.
Extent,
yet.
yeah.
Exactly. So when he came, we were able to pick it up and solve the problem.
So okay, so that's one. What do you typically see in your practice? As those who come with bad breath, what do you typically see is the cause?
Plaque.
Yeah.
Most of the time, it's still plaque.
Most
Most
of
of
the
the
time
time
it's
it's plaque. So whether it's true halitosis, pseudo-halitosis, first line of treatment is doing a cleaning. It puts the person at ease to know that one, and
Something is
especially
being
something
done.
has been done. So once you get them, you show them how to monitor it from there. Then we observe it from there.
Okay, cleaning. Tell me about this cleaning business. First of all, how is it done?
Well, so cleaning, a number of methods. What used to be there was a manual cleaning where we use hand instruments to remove the
Chisel and
plaque.
hammer.
Not chisel and
Oh,
hammer.
not chisel.
Yes, scalar instruments,
Scale-
they're hand scalers.
hand
That's
scaling.
what they are called. Very
Okay.
small, fine instruments,
Mm.
not chisel and
Mm.
hammer. But
Do you need forearm strength to use them,
oh
or you
no,
can just
just
gentle?
Just
wrist
wrist
from your
movements.
wrist. Yeah,
Okay.
wrist
Exactly.
movements.
No
to-
using
No,
no kappa,
no
no elbow action.
Actions,
No.
just wrist movements.
like a feathers touch, gentle thing. Oh,
Feathers
No,
touch,
no,
okay,
no.
but gentle
gentle
movement.
movements. Okay.
And now there's technology where we have the ultrasonic scaler, so that's what is commonly found.
How does that work?
It's a handpiece with a tip that vibrates
Mhm.
at a certain
Frequency.
frequency, and then it has water coming out of a part of it. So when the vibration breaks off the calculus or the plaque or removes the plaque, then the water washes it off. So that's what's commonly found in most dental practices.
That would be make it faster, wouldn't it?
That's
Yeah.
way faster and
Way
way,
faster.
easier
What's
and
that?
more less traumatic
Yeah.
compared to the hand
The hand
scaling.
ones, yeah.
Yes. Other technologies like the sandblasting
The
also
sandblasting, that's
comes
more
in
for
where
the
for
cleaning.
stains. So when someone has coffee or tea stains, or sometimes even nicotine stain, you can take them off
With
with
sand.
the sandblasting.
Sandblasting.
It's also another technology, but in this case, you have like particles, small, tiny particles
Mhm.
being shot at the tooth. So it has
Shooting.
Give me a better word, please. Shooting. Let's use the word spray.
Sorry, I'm being
Let's
silly.
use the
Don't
word
mind
spray.
me. I understand
It
what
makes
you
more
mean.
sense to spray,
Okay.
but like yeah.
Okay.
So then it's sprayed at the tooth,
tooth.
and then it's able to remove
Okay.
all those very tiny stains that's acquired by drinking coffee or tea,
Hmm.
smoking. Yeah.
Okay. So if we do that, we'll get rid of the plaque
Of the plaque and calculus.
and calculus.
Yes.
Yes.
How often should we do this?
I
Okay.
mean, ideally, it should be twice a year.
Twice a
That's
year.
Every 6 months.
Every 6 months.
Yes.
Mr. Kante, I want to ask you your own. When was the last time you went for cleaning? You don't say it. You're here. Catch it.
No, but people say that, oh, I missed my 6 months, so I should wait for another 6 months. No,
No.
once you miss your 6 months, your next available appointment you can get, you can go. So even if
Okay.
it's
So
7 months.
if I did it in January
yeah,
and my next one should be in July,
June,
that's not 6 months. But anyway,
July.
for the sake of
Okay,
discussion,
let's say
no,
July.
it's okay. It's okay.
Yeah.
Let's say
I'll,
July.
I'll take your June like that. it's
July.
fine.
July is
July
fine.
is
So
fine.
July. Then I missed July,
Yeah.
and it's now November.
Go.
Just come.
So I go.
Just go.
come.
So when I do
You're
my
always
November,
ready.
should I now do December?
No,
No,
doesn't
it's
work
6
that
months
way.
after.
So 6 months after.
Yes.
For the
Because you
calculus
also
to
don't
form.
want us scraping too much at
But
your.
you don't do it like, is it road wetness or they give you the date you
Yeah.
should have come?
Yeah, do it. But
no. Once you come, then 6 months
Not
after
from there.
that. Yeah.
So every 6 months, it's a recommendation that go and see your dentist.
It's recommended.
If you don't have a dentist, find one.
Yes.
I have 2 lovely ladies here. You can approach any of them.
Yeah.
Mr. Kante will give you their locations. And then you can actually see them.
Yeah.
They will have your teeth looked at. They'll clean it very nicely.
Yes.
They will give you a non-sugar toffee afterwards. and a sticker to put on your shirt that says, I went to the
And
dentist
then-
today.
and then the balloon.
Yeah.
We did do that.
You do that for the kids,
yes,
yeah.
we do.
But then your teeth would be clean.
Yeah.
Now, if you clean your teeth every 6 months, it means we avoid plaque.
We're avoiding
And
plaque,
We
you're
avoid
avoiding
calculus.
calculus.
you're avoiding
We are-
dental caries.
We are
Caries,
avoiding
cavities.
dental cavities.
Yeah.
We are avoiding
Gum disease.
Gum disease.
gum
as
disease.
well.
Yes. And most likely halitosis.
We are avoiding halitosis.
Yes.
And we are avoiding teeth falling out.
Yes.
Oh, ultimately.
Yeah, ultimately.
Nice. Okay.
And actually, we
Mhm.
also advise that you come for your 6 months reviews, because once you sit in a dental chair, we do a full examination. We'll be able to catch any condition that is trying to develop, any cavity that's trying to develop, any gum disease that's trying to. We are able to catch anything quickly. So with your consistent reviews or your consistent visits to the dentist, we're able to catch anything in the early stages. So you
Right
don't
down
have
to
wait.
oral cancers.
Yes.
So we still do a
Tumors,
screening,
cancers,
everything.
anything.
Oh.
We're able
Yes.
to catch all of them
See?
early enough.
So
It's part of your
important.
checkup.
Yes.
Yes.
You should be there.
Why should we floss?
Okay, so when you brush your teeth, you're able to clean if you do effective brushing for starters.
What is effective brushing? You
You-
see, you bring the. What is effective brushing?
So if you want to talk about brushing, we have to start from what are you using to brush. Okay, so
Please have 1 minute.
1 minute.
Yeah.
Okay, fluoridated toothpaste,
Yes.
a medium hardness toothbrush.
Medium hardness toothbrush.
And then
Okay.
we are good to go. So you brush. There are many techniques of brushing. I'd want to talk about the simplest one.
Mm-hmm.
So with that one is the circular motion.
Mhm.
We tend to do this horizontal brush scrubbing.
This one is not. good.
No, it's a wrong technique,
Mm.
and then you apply too much force. People who do this sometimes in a bid to have cleaner teeth, you end up injuring your teeth because you wear off the enamel and expose the inner
Okay.
layer, which is the dentine. That comes with severe sensitivity.
Okay.
So the circular motion will distribute.
So
the
we show us a
forces.
circle, like this.
Like-
It's like
yes.
you're drawing
A
circles on your
circular
tooth.
motion.
draw a circle.
Exactly.
Oh, but the camera is looking. Show
Oh,
me.
so you just do the circular motion, and then actually, if you want to go into details, it's supposed to be 45 degrees to the gum, so that it can go as if it's going between the teeth and the gum to brush off any debris that is lodging
Okay, yeah,
within
so-
the sulcus.
So instead
there.
of like this, I will just
Exactly.
small.
Tilt it a little, go in a circular motion, go all the way around. Then when you get to the last tooth at the back, please tilt it again so that you go behind the tooth. Because if you clean everywhere and you leave that part, you will get a hole and we'll be seeing you soon. So make sure it's every surface, go to the back. Now, if you're able to do all of this, you've effectively cleaned both the outer parts of the arch and the inner parts of the arch. However, for the space between the teeth, interdental spaces have not been cleaned.
Okay.
So it's only with the floss that you can clean mechanically between the teeth. Now, when you are cleaning, there are many adjuncts to cleaning. Apart from the floss, there's also the mouthwash. Some mouthwashes claim to have be able to remove plaque when you swish between your teeth. So they also add up as an adjunct for good cleaning. So the floss is the only thing that's going to mechanically remove food debris or plaque that
Between
has
the
been
teeth.
stuck between those. That's how important it is.
How often should we floss?
If you can do it every day, why not?
You should floss every day.
Yeah.
But not after every meal.
Well, if you have food stuck in your teeth, you can. The floss is not anything erosive. It's not going to injure you in any
Mhm.
way. So sometimes when you use the floss, you put it in between the teeth, move it up, forward and back against the tooth, one tooth, and then you move it forward and back against the next tooth. And you have to go as deep as possible. If you see bleeding, it doesn't mean you're injuring yourself. It is because there's plaque. So it's in reaction to that. So just clean it out, and then the place should heal, and then you should be fine.
Okay. So they are the water ones,
Yeah.
The-
What's
like,
up, Florence?
There's the
water
floss.
flosses.
Exactly.
They work.
Yeah, they do.
They do.
They do.
Yeah.
You are sounding.
These are new. There are new things coming, but they do. They actually work. We
Mm.
recommend it for people doing
Also
wearing braces.
Yeah.
Okay.
Exactly. So.
No, it actually works pretty well. I think
Yeah.
I've got two.
Yeah.
Okay.
So you put it inside, and the pressure
It
there.
washes out.
And
Yeah.
depending on the brand, some are more powerful than
Yeah.
than others actually. But to actually any debris to just
Yeah.
Remove it.
so if you
Yeah.
use the water one after like even after you brush your teeth
Yeah.
or after a meal and you use it, and then it comes into your mouth and you spit it out, you see that there are particles there that
Yeah.
your brush didn't actually get
Exactly.
there. So hey, If you have a water flosser, it's
Fine.
good for you,
Yeah.
and it's good for
Your oral health.
your oral health. Ladies and gentlemen, we take a short break. We'll play a song whilst we're on break. Oh, you're playing Johnny Drill. How are you, my friend? Love
Z 101.9 FM.
Welcome back. This is Z 101.9 FM, and you are listening to the Wellness Link. My name is Dr. Padiaite. I'm your host, and today I have Dr. Ama Amenin Dakon and Dr. Esther Alote, both dentists, and they've done their best to allay my fears for their needle. But we've spoken about quite, a few things, and I'd like to discuss what we should be doing going forward so that we shall have good dental practices from now on. But before that, what is the impact of sugary food on our dental health?
Okay, there's a study to show that people who taking a lot of sugary foods have a high concentration of strep mutans in their plaque. So people who do not take as much sugary food do not have strep mutans. Strep mutans is the bacteria, one of the main implicating bacteria that causes dental caries.
Okay.
So if you are someone who eats a lot of sugar, you tend to realize that it seems
You
as
have more
if you are
caries.
getting caries. It's like, oh, I had one, we've treated it, it jumped to this one. That's what they say. But it's an ongoing thing. So your diet can affect, if you reduce your intake of sugar, it can affect even the bacteria living in your mouth. We cannot alleviate all the bacteria. We live with them, but then alter it for your mouth, for the best health, for your oral health. Yeah.
So sugar is bad for our teeth.
Indeed.
Okay. Acid.
Acid.
Yes.
Do we eat acid? Yes,
Acidic foods.
Acidic foods.
Yeah.
acidic food. So the main reason why we are implicating all these acidogenic bacteria, the bacteria that form acids, is because the acidic environment causes the demineralization, the wear that we're talking about. So if you take it, maybe you do.
So if you are taking apple cider vinegar,
A lot.
yes, it will cause a lot of wear.
Wear.
Apple cider vinegar actually causes a bit of erosion of your enamel.
so you should drink it with a straw,
You can drink it with a straw.
diluted, of course.
Yes,
So with
it's
the straw.
better, and maybe
With a
use
straw, it won't
frequency.
swish around your
Your teeth,
teeth,
yeah.
so it will go straight into your throat.
Alcohol.
Well, alcohol does not have such a great impact, except for the fact that red wine tends to stain the teeth a lot.
Okay.
Contains
Yeah, so-
So
contains
appeal,
tannins.
no problem.
Sorry?
Appeal,
Let's
no
not say
problem.
that.
No, like a
say that.
direct.
You don't have a fight with appeal.
a direct
say
effect
that.
on
Okay.
the teeth like
Okay.
that. No.
Okay. Smoking.
Well, smoking is actually implicated in gum disease because of the fact that it reduces blood flow, it reduces healing, and all that. So, in people who smoke, we expect like a lot of gum disease.
Gum disease.
Yeah. And then the nicotine also stains the teeth badly. Yeah.
And your dentist will know if you smoke. So
Once
when
you open your
your
mouth-
dentist asks you, do you smoke? Please don't lie.
Don't
Don't
lie.
lie.
Because we've seen it.
Once you open
We
your
are
mouth,
asking
even
you
your gums
because-
can tell.
We're
It's
asking
written
because
there.
we've seen it.
Yeah,
Yes, so
yeah.
please don't lie.
Yeah. We look in your mouth, your palate, your gums, your teeth,
Everything
everything
is-
is telling
the
us
signboards
to
are there.
smoke.
Smoking,
Oh,
smoking.
Screaming at us.
Then we are lying to you.
Oh.
They said never lie to your doctor or your lawyer.
Ah.
Those two people, you don't lie to
see.
them. You can lie to anybody else, but not those two. Okay, so coffee.
Coffee also tends to stain the teeth, as well as tea intake, green tea. They all contain tannins and other things that.
So green tea will make your teeth yellow,
No, it's they all give
and
it
black
a
tea, and black tea will make
brownish.
You all give a brownish
It's still a
stain.
brown.
It's still brown.
It's a range of colors. So sometimes it can range from even a bit yellow, brown to dark, like really black.
Yeah.
Or we
So
can see it.
this is a
Even sometimes these cocoa beverages, the dark cocoa, those who take it very frequently tend also to.
to have this.
This
thing.
one is not in literature, but
Yeah.
it's something
It's
I've
observation.
noticed.
Yeah, that's good.
Exactly.
So these teeth whitening things that they say use this and use that, does it work?
There are different aspects to that. So some toothpaste are branded as teeth whitening, but then it's because the components, they've added more abrasives to be able to remove stains on the tooth, but they brand that as whitening. That one is different. And then there's another part of it where you're actually whitening the substance of the tooth itself. So it's more of a preference thing. But when you come, once we inform you of the pros and cons and you want to do it, we'll do it for you.
Okay. What are the best daily oral hygiene practices to prevent cavities, gum disease, and bad breath?
Brushing twice daily.
Brushing twice daily.
To start with. For a full 2 to 3 minutes, like
Okay.
Dr. Amma rightly
Let's give them
said.
3 minutes so that they.
Yes.
We'll reduce it to 2.
when they get it wrong,
No,
it's 2.5.
It becomes 2.5.
A full 3 minutes.
Okay.
And then
In a circular motion.
in a circular motion. If you
That's
can do
the
the
easiest.
45-degree tilt.
And
Yes.
tilt.
Yes.
And you
It
do all the
helps
teeth, including the
every
back
surface
of the last tooth.
Yes.
Exactly.
Yes. And then flossing as well to get the interdental areas
So floss
cleaned
every day.
every day.
Okay.
Every day. It's allowed to floss when you eat and you feel like there's something stuck, but at least once a day you should floss
Okay.
everywhere, all the spaces.
All
in
the
between your
spaces. You should
teeth.
floss each one.
Yes.
And
Okay.
and we recommend fluoridated toothpaste. You know,
Fluoridated toothpaste.
in the markets, there are people who are pushing for non-fluoridated
Fluoride, right.
toothpaste, but these are for other jurisdictions where they have fluoride in water and other things.
You don't have fluoride in our water.
No, please.
Okay.
We don't have any fluoride in our water.
Okay.
The only source of fluoride in our jurisdiction is the toothpaste.
Toothpaste.
So
Ah.
if you lose that, you won't have a protective layer around your tooth, so you are susceptible to caries. That's
That's
the
right.
cavity, the holes in the
Okay,
teeth.
swimming pool is chlorine, not fluorine.
Yeah.
Can we go to swimming pool and this?
No.
You end up with sauce in your mouth.
No, please. It's fluoride.
No.
Okay, so brush twice a day,
Floss.
circular motion,
Yeah.
get the angles
Fluoride
right,
Toothpaste.
back of the tooth. Use a fluoridated toothpaste.
Fluoridated toothpaste.
Okay. For each time we brush. Okay. What else?
And then the flossing we spoke about.
We should floss.
Yes.
And
Every
then
day.
this is one that we are not used to. Don't rinse your mouth after brushing. The action of the fluoride is topical. It means that it's like body cream. You have to put the cream on the body for it to work. But when we learn how to brush our teeth, we think after finishing we need to wash out the toothpaste and the debris and everything. But once you wash it out,
You've washed
there goes the
everything up.
fluoride. So you need to allow it to sit on the tooth. Once you do it once or twice, you get used to it.
So how
That's-
long should we leave it on the tooth?
Just leave it there. You don't rinse after.
So you
So
spit
that
out.
brings no. So that
not-
brings.
and not rinse.
Wait. So there's a question that you have brought up. That suggests that you eat your first meal before you brush your teeth.
When you
You
sleep,
brought yourself.
yes. So when you sleep, you close your mouth,
Mhm.
and then now the bacteria will now come to have a party in your mouth with the remainder of food in your mouth. So if you are the type who brushes, as we recommend, when they come, they might not have enough to work on.
So you brushed your teeth last night.
You
Yes.
brushed last night.
This morning, you are eating breakfast in the morning before you leave the house.
Yes.
But still, there was bacterial activity.
So you should brush
you want to
And
freshen
and then
your
eat
mouth.
and brush again.
You may,
You
but
see?
ideally, if you
That
brush
gives me
in
three
the
times.
morning,
That gives me three
no,
times.
if you brush in the morning, you are good to go. Then you can go throughout the day.
So I should
to
brush in the
evening.
morning, not spit out the toothpaste.
No,
Yes.
spit out, but not rinse.
Spit
Okay,
out, yes.
spit out,
the
but not
toothpaste,
rinse.
But not rinse.
And then go eat my breakfast.
Yes.
Spit out means you can spit and spit and spit, but
Yeah.
not the fact that you're not rinsing.
The breakfast will
water.
taste odd.
It won't. So when you come to the dental practice for children, we have something we call fluoride treatment. We apply it on the tooth, allow it about 30 minutes for it to work. It's entering into the substance of the tooth well to strengthen the enamel. We do it mainly for kids who are very susceptible to caries to help protect the tooth. Afterwards, they sit down, they spit for the remainder, and then they go. We
Okay.
don't rinse it out. It doesn't change the
Oh,
taste.
no, I'm okay with the not rinsing. No. I'm very okay. I just want to
Problem is
know
the first
where
meal.
I should put my first meal.
Please please eat.
So
Brush your teeth
when we
before
were in
you
school,
eat.
we had some friends. They would eat breakfast, brush their teeth before we go to school,
Yeah.
and that meant that there was nothing in their mouth.
It's a school of thought, actually.
And then some too would brush their teeth first, then eat, but then you had the food remnants in your mouth. So
Yeah.
it was just, I just trying to find out if there's any bad, if it's a, if,
There's
if
actually
a bad way.
school of thought that says that brushing your teeth in the evening is for your personal health, and then brushing your teeth in the morning is just to
It's
make
for
people
the
happy.
other people around
Because
you.
in the morning is the bad breath. The stillness in your mouth
Yes.
is what you're trying to get rid of.
Okay.
Really.
Yeah.
But brushing the night before, if you did it well, then you've taken off every food debris
Yes.
that was accumulated over the day, and so then your teeth are presumably
Clean.
sorry,
Okay.
yeah, you can presume
Okay. So
them
I
to be
shall
clean.
consider the eat before brush method.
Yeah, so you can think about it. I think
I wanted to ask something about the mouthwash. We put in water. Do we put in something? Do we put something hydrogen peroxide or something? Can we put in hydrogen peroxide?
Yeah, but there are different. Hydrogen peroxide can disinfect the mouth, so to speak. But people tend to use it out of the bottle. It's too concentrated.
No, that's too concentrated. I'm thinking of putting a few drops in the water floss.
In the water flush, yeah, you may.
You may do that. All right. So please, that was an interruption. Let's go back to our. So we've brushed our teeth.
we flossed.
We flossed.
Yeah.
And then what else are we supposed to do?
And then your regular visits to the dentist
And then regular visit to the dentist.
every 6 months.
Every 6 months.
Yes.
You may choose to use mouthwash. It's an adjunct, but it doesn't replace brushing as it stands.
When we go off air, I shall talk to you about mouthwash and its effect in other areas of the body.
Yeah.
But
So
Okay.
go ahead.
I'm going to say something.
Yeah, so sometimes we tend to recommend medicated mouthwashes. So in that case, we give it for the prescription, so use it for a specific period of time. But there are other daily mouthwashes that you may choose to use, but it's not as if it's mandatory. If you are able to, if you're able to do the cleaning and everything, well, I think you're good to go.
Okay, that is very this thing. You did mention, so that's what we're supposed to do.
Yes.
Yeah.
Sir.
I was gonna add that
yes, please do.
after every meal, because you cannot practically brush, or it's not good to practically brush after every meal, you can rinse your mouth so that the concentration of food debris in your mouth after you've eaten has greatly reduced by swishing the water. You can either spit out or swallow. It really depends on you, but rinsing after eating is really good for helping keep your mouth clean and fresh. Yeah.
You mentioned something about chewing gum and sugar in chewing gum. So we shouldn't chew chewing gum that has sugar inside.
Yes, so
Is that the recommendation?
If you are chewing gum with sugar, you're exposing your tooth to sugar for a long period of time. It's not good for the health of your teeth. But in other people, there are people that we recommend actually xylitol and other.
So if you have xylitol chewing gum, is it good?
Yeah, you may.
I have some there. Johnson.
You may. That one, we give it to people who are not salivating well enough.
Dry
So
mouth.
it's people with dry mouth and other conditions related. So that one helps with the salivation, because the saliva is good. The saliva will help buffer all these acids we've been talking about. The saliva also contains so many things. It contains things that fight against lysozymes. It contains IgAs. I don't want to talk too technical, but the saliva is
good for your mouth.
It's good for your mouth in summary. So yes, to stimulate saliva, that's okay.
Good. Thank you very much. So if we do these things, we'll have a cavity-free life.
You should have a cavity.
You should.
And a gingivitis-free life.
Indeed.
And we'll not lose our teeth.
No. You could have them till
Unless
80.
you knock it out. But
Yeah. We didn't talk about any of. See, you're not supposed to. People tend to use the bottles, the teeth to open bottles as bottle openers and all these things. It will fracture your tooth.
No, that one there, they should continue.
Please don't continue.
It will fracture.
Oh, when they continue, they'll come and see you, and then you charge them plenty.
It will fracture the tooth, and then it's painful. It's traumatic. It's everything.
Yes.
So
If you know you like drinking whatever it is in that bottle that much, get an opener with you. Put on your key.
Exactly.
Put it, that whole... Or learn the technique of opening the bottle, one bottle against the other, or against the
that's
table.
table
Yeah.
or something.
But there's a guy who opens it with his fingers like this.
Hey,
I
It's
saw
a
it.
different
I was
level.
shocked.
that's a whole different.
With his hands, his fingers. Yes. Then he takes it out.
Wow.
It's a different level.
That's a different technique. We've not seen that.
Ladies and gentlemen, we've had a very enlightening program. We've learned a lot. We are very, very grateful to our two dentists, Dr. Ama Amenin Da Kun. She says she can be found at your favorite dentist. We shall tell you where that is. And Dr. Esther Alote. Mr. Kante will have access to their locations, appointments. If you need to see them to continue where we have left off, they will do a good job. Just mention my name. They will give you discounts.
Why not?
But we are really grateful to the two of you. You've enlightened us greatly, and there are things that we are going to do from today because of this encounter that we have had. And I shall get my pregnant woman to be going to the dentist as well.
Please.
I think that is very
much.
important
Thank you
for
very
our side. Thank you very much for listening, and I hope we have also made some changes in your life. We shall exit with our song Lover of My Soul by Elliot Lamptey.
Zed
Take care, God
101.
bless, and we'll see you next week. Bye-bye.
Zed 101.